Welcome to the To Your Health podcast, your go-to source for everything health, fitness, and the latest in medical insights. I'm your host, Rhonda Alfred. Joining us on this episode is Dr. Sindhura Bandaru. She's an endocrinologist who has a board certification in obesity medicine, and Michelle Briceno, a registered dietitian who is board certified in obesity and weight management. Welcome to the show, ladies.
Thank you for
having us.
All right, well, let's get started. We have a very interesting topic, but before that, let's introduce yourselves to our audience and tell us a little bit about yourself, Dr. Bandaru.
Yeah, so I was born and raised in India where I completed my medical school education. After completing medical school, I wanted to pursue residency in the US, so I moved to the US for my residency. I did a residency in internal medicine at Southern Illinois University, Springfield. Subsequently, completed a fellowship in endocrinology, diabetes, and metabolism at the University of Wisconsin, Madison. That's where I gained comprehensive expertise in managing wide spectrum of endocrine disorders. Following my fellowship in 2020, I joined Terrebonne General Health System as a full-time endocrinologist, and I've been with Terrebonne General since then. Because obesity medicine and endocrinology, they complement each other. To expand my knowledge in obesity medicine, I took a obesity medicine certification course and got certified in obesity medicine about a couple of years ago. So I'm currently certified in internal medicine, endocrinology, and obesity medicine.
Okay,
That's briefly about me.
Okay, well, thank you. And Michelle, tell us a little bit more about you.
So I'm a registered dietitian in our Diabetes and Weight Management Center. My certification is obesity and weight management as well. I see children all the way through adulthood, and not only for obesity, but maybe weight gain, weight maintenance, anything to do with weight-related disorders as well.
Right, and I know you two work together very closely with our patients.
Yes.
Okay, well, let's get started. Dr. Bandaru, first question is for you. You said you have both of those medical specialties. How do you work and integrate those two together?
So endocrinology and obesity medicine, they're deeply interconnected fields of medicine. They complement each other in several important ways because hormones are involved in regulating energy expenditure, weight regulation, fat distribution, all of which play a key role in obesity. Endocrinology is all about studying hormones and their effects on the body. These hormones like insulin, leptin, ghrelin, cortisol, thyroid hormones, sex hormones, all of these play a key role in regulating appetite, satiety, energy expenditure, again, fat distribution. So they kind of go hand in hand. As endocrinologists, we evaluate for endocrine causes that could contribute to weight gain, like hypothyroidism, Cushing's, where there is excess cortisol production, PCOS, hypogonadism, meaning sex hormone deficiencies. So we offer that insight from the hormonal and metabolic standpoint. So we are making sure that we are addressing all the underlying potential causes of weight gain and kind of addressing them as a whole.
Okay, so that really comes in handy. What are the most common conditions that you treat?
Common conditions include diabetes, thyroid, adrenal, pituitary, PCOS, osteoporosis, cross-sex hormone therapy for transgender patients, and of course, obesity.
Yeah, you really
management.
don't realize how much hormones affect how you feel and everything you do.
Yeah.
At what point, though, when someone is having problems with weight loss or control, when would you recommend they see a doctor?
If a patient has BMI, which stands for body mass index, if BMI is equal to or more than 30, regardless of whether they have any obesity-related medical problem or not, they do meet the criteria to consider a weight loss medication. So that's one criteria. But let's say if they have at least one obesity-related medical problem, like type 2 diabetes, hypertension, dyslipidemia, PCOS, obstructive sleep apnea, or fatty liver, non-alcoholic fatty liver, any of these, even if their BMI is 27, they can still come to me so we can talk about prescribing a weight loss medication, talk about some lifestyle behavioral interventions.
So, what does a treatment plan look like?
When I see a patient for the first time, I tend to get a comprehensive medical history, which includes their weight history, their previous weight loss attempts. We review their medications in detail because some of those medications can contribute to weight gain. We screen them for obesity related those metabolic problems like type 2 diabetes, hypertension, lipid disorders, things like that. And we do some basic blood work from the metabolic standpoint, like we check their liver function, their thyroid function, the lipids, screen them for diabetes. So kind of get a comprehensive medical history to start with. And the next step would be to talk to them about lifestyle interventions, because medications that we do for weight loss must be done in conjunction with healthy lifestyle. So kind of focusing on diet. Michelle can speak more about that, but kind of briefly going over the dietary changes, the physical activity. We address any sleep-related issues like obstructive sleep apnea, or they have insomnia. We refer them to the specialist, sleep medicine specialist. So and then we talk about the medications, and I go over the pros and cons of each of these weight loss medications that are available in the market. We talk about the insurance coverage, the affordability, look at the contraindications, things like that, and we try to get them on a good weight loss medication, and then kind of follow up every couple of weeks to start with, to monitor their progress, see if they're having any side effects, things like that.
So it's a very comprehensive
It's
plan.
a comprehensive plan, and it's a long-term commitment.
Let's bring Michelle in. You say y'all work together. Michelle, how do you come up with a personalized treatment plan for these patients?
So once they go through the compromised treatment with her, then they typically will see me and we'll go through just their history of what has worked for them, what has not worked for them. Have they even ever tried anything? It may be that their whole life they never had issues, and then now they have a metabolic condition that causes this weight and they don't know how to deal with it. And so the mental, the physical, the what they're eating, just their lifestyle, we look at just everything in general. Depending on where they're at mentally with these issues, it may be that they've never had any education. They have to go through very basic stuff. I have people who have watched their weight their entire lives. They know probably just as much as me in some areas. And sometimes it's just hearing maybe one or two things that I'm like, yep, that's probably the key that we need to change. Let's make these small changes. It may be timing. It may be certain foods. Sometimes it's just they're eating good foods, but too much of those foods. And so we try to figure out what are those issues we're having. It may be, hey, let's start some basic, physical activity program, just something small that we can incorporate to get started. And we recommend them continuing to come in so that way we can monitor and make sure between medications and therapies and nutrition that we're on the right track in a healthy way.
Oh, so that's a big compliment to the things that Dr. Bandaru is doing.
Yes.
And I know the ever popular shot right now, how do you incorporate those GLP-1s into your treatment plan?
First thing is, again, getting a comprehensive medical history, and then making sure that they don't have any contraindications to GLP-1s, like any family history or personal history of medullary thyroid cancer, history of gallstones, pancreatitis, gastroparesis. Kind of we review all that in detail. If a patient doesn't have any contraindications, then I talk to them about the mechanism of action in detail, go over the possible side effects, what is that they can do to mitigate those GI side effects, possible GI side effects. Then I set realistic expectations as to what to expect. Usually we say 1 to 2 pounds a week weight loss is the goal. Overall, like 5 to 10% of weight loss over 6-month period should be the goal. And it's not always looking at the scale. We look at improvement in their energy levels, their mood, their quality of life, improvement in their metabolic parameters like the lipids, blood pressure, their glucose control. And we kind of start them at a baby dose and slowly titrate it up as tolerated. And the most important thing that I make every patient aware before I start them on any weight loss drug, not just a GLP-1, is that it's going to be a long, or at least a long-term commitment,
Right.
because none of these medications bring that fat mass set point lower permanently, meaning whatever weight they lose on any of these medications, that effect persists only as long as they take the medication. For whatever reason, if they get off of it, they tend
It's
to gain
going to go
that
back.
weight back. So
Yeah,
we
that's
kind
why
of set
Michelle's so
realistic expectations
important.
to work on the diet, especially. Yeah.
Right. So, Michelle, how do you work with patients that are taking things like Ozempic?
So that's one of the first things I start off with, because a lot of patients come in and say, my goal is to lose the weight and get off the meds. And I always say, this is meant to be a long-term medication. It is something, you didn't magically start making this hormone because of this medication. So it's not going to all of a sudden, start when you get off of it. It's giving you something that you were missing before. And so we discuss that. And then we start going over some of the side effects. Are you having any GI side effects? Are you eating enough protein to protect muscle loss? Because muscle loss and lean body mass loss is one of the most prevalent side effects that I see. And so, there's terms like Ozempic face and things like that, just because of the massive muscle loss. And so we discuss the importance of getting certain nutrients in to protect yourself. Because if we lose this weight and you do end up getting off these medications and you've lost muscle, you can have detrimental side effects for later on. And so we make sure you're eating enough protein, you're eating enough fiber to help out with some GI side effects, making sure you're getting enough calories as dosage goes up in some individuals. And this is just all over the place, not even just, her patients. But some people won't say like, hey, I can't eat anything. And so they don't tend to tell their doctor when they're having issues. And so they'll just say, oh yeah, I just want to go up in dose so I can lose weight quicker. And then they end up with major issues. And so discussing like why that's important to go over with, your specialist, and how bad it can be if you don't. And so we try to like touch on, these are the major issues and this is what we need to do food wise to help this out. You have the tool, but you need to do the work in order to make it work appropriately.
Right. Is it safe to exercise during this time?
Recommended.
Recommended.
Yes.
Okay. So
Yeah, we usually say aim for at least 150 minutes per week of moderate intensity aerobic exercise, meaning cardio, and combine it with some resistance training at least 2 days a week. And that's again important to preserve muscle mass.
Right. And so you have energy so that you can function. So what happens if somebody hits a plateau? How do you help them deal with that?
On my side, what usually happens is we're at a lower calorie amount already. So it's not that we have to decrease our calories, but what tends to happen is when you're starting off, you're very strict. You measure things, you weigh things, you portion things, and then you start eyeballing those things. And then those eyeballs become bigger portions. And so over time, you start slowly increasing calories in. Or maybe you were super, super strict when you first started, and then all of a sudden you started going to eat out more, drinking a few more drinks at night. And so some of those habits tend to fall back into place. So sometimes we just have to reevaluate, like, hey, what are you doing? We started doing this, you weren't doing this before. And just sometimes those little changes will bring that weight back down.
Well, that's a great tip. All right. Well, thank you so much for sharing this helpful information and being with us today.
Thank you for having us on the show.
For more information about weight management, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcasts. Thanks for joining us.